All right, let's talk about cetirizine. In this explainer, we're going to break down the science behind one of the most popular allergy medications on the planet. I mean, have you ever really thought about it? How does one little pill just shut down all that sneezing, itching, and misery? Well, we're going to get into the nitty-gritty of exactly how it pulls off that much-needed relief. So before we can get to the solution, we've got to understand the problem. What is actually going on inside your body when you have an allergic reaction? What's all the fuss about? Okay, it's basically a four-step chain reaction that happens super fast. First, you breathe in some pollen or pet dander. Then, your immune system totally overreacts, thinking it's under attack. And here's the key part. Step 3, your cells release a flood of a chemical called histamine. That histamine is the real culprit that kicks off all those awful symptoms. And this is where our hero enters the story, cetirizine. You probably know it by brand names like Zyrtec. It is specifically designed to jump in and stop that chain reaction cold. Now, the important phrase here is second generation. This is a big deal. It means it's not like the old school allergy pills that knocked you out. This one was engineered to be way more precise, to zero in on the allergy problem without causing nearly as much drowsiness. So how does it do it? How does cetirizine actually go to war with that flood of histamine? This is where the biology gets really, really cool. Think of histamine like a key, and all over your body, on your cells, you have these little keyholes called H1 receptors. When the histamine key fits into the H1 receptor lock, boom, that's when you start itching, sneezing, and your eyes get watery. So what we have here is basically a battle, a race to those keyholes. Histamine is trying to get in there to turn on the allergy symptoms, but cetirizine is trying to get there first to block the lock. And this is the perfect way to picture it. Cetirizine doesn't actually get rid of the histamine, it just gets to the receptors first and puts a cap on them. It physically blocks the keyhole so the histamine key has nowhere to go. The message to start the allergic reaction just never gets delivered. Simple, but so effective. Okay, so that's the science. It's pretty amazing, but let's talk about the practical stuff. What do you actually use it for, and what should you expect when you take it? Its main gig is tackling all those classic hay fever symptoms. You know, the sneezing, the runny nose, the whole 9 yards. It's also a powerhouse against hives, bringing down that redness and awful itching. It's a real go-to for skin-related allergic reactions. And check out how fast this stuff works. You can start feeling better in as little as 20 minutes. It hits its peak fighting power at about the 1-hour mark. And here's the best part. It keeps on working for a full 24 hours. And that brings us to the magic number, 24. A whole day of relief from just one single dose. You can see why it's so popular. You just take it and forget about it. Of course, with any medicine, it's super important to know about potential side effects and what to look out for. Let's make sure we're using it safely. So let's break this down. On the left, you have the more common stuff. Some people might feel a little tired or get a dry mouth. But on the right, you see the things that are really rare but really serious. If you experience anything from that right-hand column, you need to seek medical attention right away. And these points are crucial. Your kidneys are what clear this drug from your body, so if you have kidney issues, the dosage has to be adjusted. That's a must. Also, you've got to be really careful mixing it with anything else that can make you sleepy, like alcohol, because it can make that effect much stronger. So, to wrap up, here are 3 pro tips. 1, non-drowsy affects everyone differently, so see how you feel before you get behind the wheel. 2, it works best as a shield. Take it before you're exposed to allergens if you can. And 3, remember, it stops the itching and sneezing, but it doesn't clear a stuffy nose. That's a decongestant's job. So this idea of a simple cap has completely changed the game for millions of allergy sufferers. It's elegant and it works, which really makes you wonder, right? As we learn more and more about our own immune systems, what's coming next? What will the next breakthrough look like?